If you have a client or athlete who's kind of getting that hikey shoulder position anytime they reach the side, and it's not anything anatomical, and you know that the muscles are all firing up, it could be just a proprioception awareness issue. So I've got 2 exercises that you can pair together to get that firing up properly. I'm Tom Swales here, Advanced Movement Therapist. Today I'm going to show you 2 exercises to help teach your client how to feel that shoulder position as they move, past that 90 degrees into the overhead position, so they're not getting that hikey, pinchy shoulder pain with pressing or overhead. So to start, we're going to take a nice light kettlebell. We don't need a heavy weight for this. We just need some resistance to apply compression and utilize that grip reflex that we talk about in the AMT system. I like the kettlebell because it's an off-centered weight and it forces the shoulder and the grip to work a little bit harder. So you can use a dumbbell, but kettlebell is ideal. So we're going to start on our sides. On the affected, we're going to initiate that grip. So I'm going to draw in, set that core, pull it into my chest, pretend it's a heavy weight. I'm going to lock down on the front here. I'm going to press it up. Now here, I'm punching towards the ceiling, so I'm not letting the wrist fall into extension. I'm going to keep that kinetic chain nice and locked, nice solid grip, and I'm just going to simply rotate through the range of motion that's available. Now, we can train 2 positions in this. We can go into protraction and train the rotator cuff and the grip, or we can go into retraction and train the rotator cuff and the grip. Depends on what the client needs, okay? Both are important, so figure out which is the harder one for them to do and then go from there. So we're going to do about 5 to 10 rotations to see if we can clean that up. And then we're going to move into the side position. So I'm going to initiate a roll, setting the core with my hip, okay? That other arm comes up overhead. I'm pushing with my hip so I can control. I'm keeping an eye on the kettlebell. And as I get into the side position, I'm going to swing my top leg over to lock so I don't continue to fall into rotation. And then in this position, I'm just continuing to rotate. For a lot of people, this is going to feel super uncomfortable. You might see this kind of cogwheeling, this really uncertain. It's because the nervous system's not really familiar with this movement. And if they feel pretty good with that, you can get them to do a crooked arm bar and you just have them take it to where it feels kind of a little tight. Now I'm really pulling, I'm activating my scap, so it's not just fall with the weight. I'm squeezing my traps there, my middle traps, and locking that in. And then I'm just giving a little rotation. As I rotate, you can see the pec on the front starts to relax and I find a deeper position to press from. So before I press up, I'm going to give it a solid grip, press it up. And then the straight arm bar, we're going to lock those glutes to protect the low back, and I'm just going to press the hips into the floor. And I'm just giving a little rotation here. Don't press from here unless you have extreme range of motion. I don't have that good, but if you have control here, go for it. So again, another 5 to 10 rotations to really bring in that awareness, slowly transition back onto the back. And then the last position, we're just going to roll to the side and work and open up the back of the shoulder and activating that pec across the front here, okay? So if we have some tight posterior capsules, this might be pretty challenging. I can feel my pec starting to spasm here. And again, we're just creating some compression and some awareness with the grip and some resistance. So pairing up with compression, we're going to add traction or distraction. The way that the joints work is through compression and distraction. So when we hang off something, we get that traction, rotator cuff or muscles have to hold the joint into place, or with compression, which we already went over with kettlebell. So we're going to facilitate this with a 1-arm ring hang. I'm going to initiate my grip first. I'm going to make sure that shoulder's in my back pocket here, make sure my neck is relaxed. I'm just going to give it some rotations. So right now I'm in retraction to lock that into place, but I can allow it to come into protraction. So I'm opening up and creating some space in the shoulder, but still teaching the muscles to work in this position. From here, we're going to transition into kind of that shoulder abduction position, and we're going to do the same thing. We're going to rotate, full range of motion, okay, keeping our position and our posture. And if we have it, let's pull a press into this, okay? I can play with some rotation in the same position as we did with the kettlebell. And then we can roll. This is kind of like our hanging straight arm bar. And I'm locked up in the front here. I'm squaring up my pelvis. I'm rolling that shoulder in my back pocket, so I'm not pulled and pinched forward, straining that bicep tendon. And I'm going to do some rotations here. Okay. Again, 5 to 10 reps. This should burn. If you're doing this right, it should burn. You should feel burn in the shoulder, you should feel burn in the grip. We're trying to create endurance in these muscles so that they stay on when the bigger muscles are working. And then the last one, and I'll just switch arms to show for demonstration, we would rotate. So if I was on the left, we're going to rotate to the side. Same thing. We're opening up that posterior shoulder. I still want the pec to be active, so I'm still kind of squeezing that so we get some reciprocal inhibition and create some rotation here. I can do some pulling in and out of this position to get those scapular tractors working in the long range, or you can do more of the kinetic chain by initiating a roll. Give those two exercises a shot. If you are rehabilitating any kind of post-op surgery, shoulders, this is a great exercise. Even without the weight, just getting your clients to roll and position. You can have them squeeze a tennis ball just to get that irradiation reflex going on in there, and teach them how to position that shoulder so that when we get them moving in the open kinetic chain or with our pushing and pulling, they have a nice clean pattern. If you like this content, you can head over to amtcertified.com and find out more how to use a lot of these reflexes with your shoulder rehab.